Welcome to your rotation in obstetrics and gynecology. This video will show you a few tips and tricks for your time in OB triage, the delivery room, and GYN triage.
Alright, Stormy, so this is the medical student room. This is where you guys will hang out after you're done rounding on your patients in the morning.
Okay.
Just so you know where some things are. Your personal protective equipment, your booties, your mask, everything you'll need for deliveries are up here. You guys can restock throughout the day. And then your rounding sheets that you use when patients come in is right here as well. Okay? And then to practice suturing and tying knots, we have material for you here and here to use as well. Okay?
Sounds
Let me
good.
show you where the patient rooms are.
Okay.
In the process right here in triage. Alright. And then so after patients are done getting registered, they'll come in, meet our nurse and our tech. We'll take them in the bathroom, get them changed, and then we'll get them in a room, get their vitals, and after all of that is done, then as students you'll be able to go in and meet your patient and get your history and do your exam. Okay? So our expectations are, you'll go in the room when you get your history, make sure it's detailed, things you'll want to do for your physical exam, a head to belly exam. You'll check fundal height, which we'll go over, and you'll review their fetal heart tracing, which will be on the monitor, which I will show you as well.
Okay.
After you're done getting your patient's history, you'll come over here and you'll present to the nurse midwife or resident who's taking care of that patient.
Okay, sounds good. Dr. Lewis, I'm ready to discuss the patient.
All right, perfect. So just remember things that we want to make sure we do. Make sure your presentation is in SOP format, okay? In your beginning of your presentation, I want to know if the patient has any vaginal bleeding, contractions, loss of fluid, and if they're feeling baby move. Okay? And then you'll talk through the fetal heart rate tracing with me, all right? And then I want to make sure you have a plan developed, know what labs you want to order, what imaging you want to do, and then what further exam you want to do for your patient.
Okay.
And you can help your resident or nurse midwife by grabbing supplies for your exam. In this cabinet, you can get your towel for your ultrasound, and then on the other side, we have supplies for pelvic exam. You'll want to grab swabs to check for infection, gloves for a sterile exam, and a pelvic exam tray to do your speculum exam. You'll be expected to do the pelvic exams, and you'll be taught how to do ultrasounds. After you have your supplies ready, you'll want to grab a stool for your exam. Then you'll come in the patient's room with your chaperone and your resident or nurse midwife and get the bed ready for a pelvic exam. You'll set your stirrups up, take the sheet off of the bed, and remove the bottom portion of the bed. Don't forget to review the fetal heart rate tracing with your resident as well. This can be found on the monitor in each room. Also in that monitor is measuring tape to check fundal height. Remember, this is measuring from the pubic symphysis to the top of the uterine fundus. Everyone who comes into triage needs an abdominal ultrasound as well. Ultrasounds can be found over here across from the second bathroom. Make sure they're plugged in at all times, and don't forget to wipe them off with the green wipes after you're done with your exam. This is the board on labor and delivery that you can reference to find out where patients are in their labor course. In the morning, you will introduce yourself to the patients on L&D as well as their nurses. Check the board frequently to stay on top of these things. Actively participating with patient care on L&D is a great way to learn about cervical exams, reading strips, and managing labor. Take advantage of this opportunity. Although you'll have most of your patient encounters in triage, medical students will also attend all vaginal deliveries and C-sections. Your intern will keep you updated on when C-sections roll to the OR so you can join. Here is where you'll get your boots, mask, and scrub cap. Make sure you get the long booties for these cases. Try to go to the OR with anesthesia so you can experience placement of the epidural. There are 3 operating rooms back here. and the scrub stations are here as well. When a patient is 10 centimeters dilated, a resident will alert you that the patient is complete. So you can go to the room with the patient's nurse and begin pushing. Again, make sure you have your booties and glasses on. You will put on sterile gloves and push with the patient until she is ready to deliver. Sterile gloves can be found in the bottom drawer of the delivery cart. When the patient is ready to deliver, an overhead call will be made for doctor for delivery. At that time, you will take off your gloves and change into your gown and a new pair of gloves. Don't forget to open the gloves sterilely onto the delivery cart. You will place your gown on sterilely. Make sure you read up on the steps of a delivery beforehand. You will have the opportunity to deliver both baby and placenta if you are well prepared after a few deliveries. Also, don't forget that we're all a team. After the delivery, hang around to help the patient get cleaned up and to put the bed back together. Your nurse will definitely appreciate this. This is the medical student room. There are 2 computers in here that you can use to access patient information and look up your patients before you go to see them. Also, in the cabinet above the first computer is the GYN interview template. Make sure you use this to help when you're going to interview patients so you have a good presentation for your resident. Although you will spend most of your time in GYN triage, you will also be in the operating room, either in the main OR or in GYN outpatient surgery here on labor and delivery. Be sure to go with your resident to meet the patient before your case starts. It's also important to have good communication with your classmates and the residents so that everyone knows what surgery everyone will be doing and we know where you are at all times. This is GYN triage. When patients come in, our nurses and techs will start to triage them, get their history, and draw their blood. As a student, you can come in, introduce yourself to the nurse and the patient, and see if it's okay if you participate in their history taking.
Hey Stephanie, is it alright if I step in and listen?
Sure, of course.
My name's Jordan, I'm the new third year here.
Great. There's our patient.
Hi ma'am. I'm just going to listen to some of the answers for your questions. Hey Dr. Lewis, I just saw Miss Rosa. She's 8 weeks pregnant with vaginal bleeding. Do you want me to put her in an exam room or have her wait in the chairs?
Yeah, there's not many patients here right now, so we can go ahead and get her in an exam room. Just have her get undressed from the waist down and cover up with that sheet, and then we can go in to see her. Also important, you'll come back to me and do your presentation. Mm-hmm. Make sure it's in the SOP format, okay? And then just have a plan. Know what labs you want to order, know what imaging you want done, and be working on a differential diagnosis in your mind. Okay. All right? The student will be responsible for doing pelvic exams with assistance from the residents. After the pelvic exam, you'll do a transvaginal ultrasound led by your resident or nurse practitioner. Actively take responsibility for your patients. After your exam, make sure you follow up on labs and imaging and report these findings to your resident or nurse practitioner to help expedite patient care.